Hello everyone, Dr. Fink here. Today we'll talk about what happens after a steroid cycle, also called PCT, post-cycle therapy. Quick disclaimer, this is not medical advice, this is entertainment only. So, steroid cycle, people put on muscle, they become big, strong. What happens afterwards? Well, if you stop with steroids, your body will readapt to what it was before, and you will most likely lose a lot of those muscles you put on during the cycle. Okay, so there's a way to limit the amount of muscle you lose after a steroid cycle. Okay, and this is why it is important to understand the post-cycle therapy. Okay, let's say you were on PDs for 6 months. So here's your testosterone level. It goes up and you're high, high, high. And then at this point, after 6 months, you say, okay, I'm going to stop. Okay, so you're going to drop. Okay. And let's say you started at this level and now you will crash all the way down. Okay. Because you're basically shutting down your own production during this time of supraphysiological levels of anabolic steroids. Okay, they basically tell your brain, shut down the production of testosterone. We already have enough androgens. Okay, that's why when you stop cold turkey, your testosterone production will go bottom low. Okay, and if you keep on just ignoring that, your testosterone production might take a long time to recover. Okay, and this depends on the dosage and the duration of the cycle. Okay, of course, if you did 3 months of 250 milligrams per week of testosterone, well, your recovery naturally might occur in a couple of weeks, if not more. Okay, but let's say you were for years on DECA, TREN, on long-acting compounds, and then you stop cold turkey, well, your body will have a very, very hard time to recover, and you will be probably low testosterone for a long period of time, which is in itself very unhealthy. Because remember, testosterone levels below 3 to 200 are also qualified as hypogonadism. Okay, so this means that your cardiovascular functions, your metabolic functions, bone health will probably go down if you have too low testosterone. So this is a major health risk if you go cold turkey after a long steroid cycle and you let it go like this. Okay, so of course it depends on the compounds, as I just mentioned, and nowadays we can ask ChatGPTs or there's calculators out there. You just put in the name of the compounds and then the duration, and then they can give you basically when you have to start your PCT, which we will go into right now. So the PCT, which stands for post-cycle therapy, is something that helps you recover faster from the cycle. Okay, so it helps you body telling your body, now we have to start our own testosterone production again. Now we have to become healthy again. Okay, and this is done via several ancillary drugs. Okay, we have Nolvadex, we have Clomid, and we have HCG, human chorionic gonadotropin. Okay, these compounds can be used alone, or they can be used together in some combinations, depending on how heavy the cycle was. Usually, for very mild cycles, people tend to use Nolvadex. On a little heavier cycles, maybe Clomid, and if the cycle was very heavy, a combination of Clomid and HCG. Okay, so Nolvadex and Clomid are selective estrogen receptor modulators, okay, SERMs. So they basically prevent estrogen from binding to a receptor, which gives you more testosterone. And they also stimulate the production of testosterone. HCG is human chorionic gonadotropin, which is mimicking a luteinizing hormone. Luteinizing hormone is basically the hormone that triggers in your testes the production of testosterone. Okay, so this will tremendously help you with the recovery of your own testosterone production. And again, everybody is different, so some people react differently on those drugs. So it's basically trial and error, which medication works for you, which cycle you had, how long you were on it. And some people after heavy cycle might recover after 3 months, 6 months, 9 months, 1 year, 2 years. It all depends on the individual. Okay, and as a rule of thumb, from my own perspective, from what I read in previous research, I think that clomiphene HCG combination is very powerful, and if that is done correctly for 3 to 6 months, then usually testosterone production, your own testosterone, endogenous testosterone production should come back. And then it is also very important to look at the sperm parameters, okay? Because sperm production is also shut down very heavily during a steroid cycle, okay? That's why it is crucial to take a blood test, but also a sperm test, okay? So I would recommend everybody after 3 months and 6 months to take a blood test, see your LH and FSH levels. Okay, LH luteinizing hormone, FSH follicle stimulating hormone. To see if LH would basically tell you how well you stimulate your testosterone production, and FSH how well you stimulate your sperm production. Okay, and then your testosterone levels, total testosterone, and also the sperm levels. Not only your blood levels, but also sperm levels. Total count of sperms, motility, and this will give you a good idea if you recovered from the cycle or not. Okay, you might have acceptable testosterone levels, but you might have a very low sperm count. This means that you're not fertile. Okay, some people just look at the blood and think, oh, 6 months passed, my testosterone is back to 700, I'm fertile again. No, it doesn't work like that. You also have to look at your sperm levels. Okay, so very important here. So if this HCG and Clomid protocol doesn't work, if you're still not fertile after 6 months or 9 months, then you can introduce a different drug, which is called HMG. And HMG is basically stimulating directly FSH, so follicle stimulating hormone, and this will in your testes directly stimulate sperm production with also testosterone production. Okay, so the introduction of HMG should be the last resort after using HCG and clomiphene, and if that doesn't work, then HMG should do the trick and get you fertile after a couple of months of a combined approach with those drugs. Okay, but again, it is very important to plan your PCT, your post-cycle therapy, after your cycle. Otherwise, you might end up losing a lot of your muscles, and you might end up being on low testosterone for a long period of time, which is also very unhealthy. Okay, so it is crucial to come back to normal testosterone levels after a cycle, to first prevent losing what you gained, and also to stay healthy. Okay, don't forget high testosterone, very high testosterone levels, super physiological testosterone levels have side effects, but also very low testosterone levels have side effects. Okay, so there's a balance, a healthy level of testosterone levels you want to aim after that post-cycle therapy. Okay, and as long as you monitor your other health parameters, liver, kidney, cardiovascular function, lipid values, then you want to make sure to always monitor those. And if during the cycle those values get abnormal, you want to immediately stop the cycle and go on PCT to prevent further damage. Okay, so constant monitoring of your blood levels during the cycle is also very important to stay healthy and minimize the risks. Okay, I don't recommend anybody to use PDs and steroids, but for those who use them, please monitor your levels and make sure all your numbers are within range. Otherwise, stop and seek medical advice. Okay, so PCT very important in steroid cycle. It is not only the period when you're blasting steroids, when you're getting big, but also PCT is basically helping you to retain that muscle and to stay healthy after the cycle. Okay, I hope this was helpful, and please let me know what you think and comment down below. Thank you for watching.